So the idea for this course came from a meeting that I went to in 2017 in Atlanta, Georgia. There were about 15 researchers, and we were really meeting to determine how could we do a better job addressing spirituality in mental health care. We know from the research that client outcomes are better when we address spirituality. We know that clients want this. Unfortunately, graduate schools aren't teaching this, so there's a real gap between what's happening in our training and what is happening in the real world. So as a result of this meeting, we decided to put this research project together, which is an online training course that we called Spiritual Competency Training in Mental Health. We put it on edX. It's an online course. There's 8 modules. And the goal was really to help providers to increase their confidence and their competency addressing spiritual issues in mental health care. One of our first challenges was to figure out how to disseminate the program. We wanted to do it on a large scale, and it was just going to be impossible to do that in person with our small research team. And at this point, I had been directing several programs online here at UMB, and I knew the reach and the effectiveness of online education. So I put this forward to the team, and they loved the idea, and we ultimately decided, let's offer the program online. Our participants really loved that too. They loved the accessibility of it. They loved the convenience of it. So it was a really great way to go. We had to think through how to assess learning without having an instructor behind the scenes grading, because we wanted to disseminate this broadly and we didn't want it to be tied to an instructor after the research was done. We had to have a way to assess learning, but without an instructor doing the grading. So ultimately, we decided we'd have self-reflection questions and knowledge checks, which are like multiple choice questions at the end of each module. The self-reflection questions and knowledge checks were forced answer. So they had to answer those before the content in the next module would be unlocked. And then the knowledge checks were automatically graded, so we didn't need an instructor. Participants mentioned that they've already started modifying their behavior based on the training program, which was probably the most rewarding feedback for us to get, because ultimately that's what we wanted, was behavior to change in the clinic. Some of them mentioned that they've added in questions into their intake form, so they're asking more questions about the client's spirituality and religion. And many of them mentioned that they're feeling more confident, more comfortable addressing these issues with their clients.